Namaskar dosto and hello. Myself Dr. Sandeep Jyot. By education I am a doctor and by passion I am NLP trainer, parenting coach and life coach. Today in this beautiful morning we are going to discuss a very important topic which is very neglected in parenting, that is drug addiction in teens. Teenage is the age when there are chances that kids can go into drug addiction more, and studies have shown that if kids of teenage goes into drug addiction, there are more chances they will be lifelong drug addicts. Many parents can't imagine that how big this drug addiction problem is. Out of every 10 teens, 2 are suffering from drug addiction, and some parents think that their children are not vulnerable to drugs and they are immune to drugs. With teens, parents make two major mistakes. Mistake number 1, parents confuse between intelligence and maturity. Parents think that their kids are smart enough, but my dear friends, kids smart doesn't mean that they can take proper decisions, because decision making power is in the pre-cortex region, and that pre-cortex region fully developed at an age of mid-20s. Mistake number 2, that not recognizing the changes in the teens. Change in sleep, mood, friends, activity level, academic performance, weight, personal hygiene and so many other things can all a signal to a substance abuse problem. So pay attention. Monitor your child's welfare with particular care at times of transition. Moving to a new school, onset of puberty, breakups with boyfriends or girlfriends. My dear parents, please notice these signs in your teen. I had divided this presentation into 3 parts. First, we have to discuss why teens take drugs. Second is that what parents can do to prevent drug addiction in children. And third part, if children start taking drugs, what steps parents can take. Why teens take drugs? There are many factors, but I have divided into 4 parts. Number 1, to fit into. To impress their colleagues, other kids, to fit into new social situation, because kids think that drugs are cool way. Second, to be social. Some teens use drugs because it lowers their inhibitions and make them more comfortable socially. Third, to deal with life changes. Change is not easy for anyone. Some teens turn to drugs to deal with situations such as moving, starting at new school, puberty and going through parenting divorce. Fourth, to ease pain and anxieties. Teen may use drugs to deal with problems with family, friends, school, mental health or self-esteem. What steps parents can take to prevent drug addiction in children? Most important factor, as I always tell in my workshops and in my videos, be a role model. In a study, it was found that if parents are taking some kind of drugs, alcohol or cigarette smoking, then there are higher chances children that they will be drug addict and they can go into drug addiction. Then after that, communicate your values to your kids clearly. If you are driving your car and you can see that someone is drinking and driving the car, tell your child clearly that how this person is dangerous to himself and others who are traveling on the road. When you are watching some TV and you see some drugs, then communicate to your child that how drugs can affect memory, health, future and career. If you are watching someone smoking a cigarette on roadside, then tell them how it's dangerous for himself and others who are having passive smoking. Tell them that how this affects the other person around him, about the smell, about the lung cancer and other things. Be a friend of your teen. Communicate with them. Trust them. For example, if your child comes to you and says, Papa, yesterday my friends were taking marijuana, what will your reaction? You will say, leave your friends, they are bad boys, I will kill you if I have seen you next time with those guys. That's very dangerous, my dear friends. If you react like this, then that child is never going to communicate anything with you because he sees your reaction. You can also respond that, okay, your friends are taking drugs, you're not taking, it's very good, my son, that I am proud of you. Parents must understand that why teenagers start taking drugs or something else. Because at teenage, the brain of teens are very, very vulnerable for experiments. They take some drug for one time and become addicted to that. Information about drugs and communication and knowledge about your child is very important in the teen years. Information that older teens are more likely to use drugs than younger teens. Knowledge about different drugs are also important for parents, like marijuana, LSD, cocaine, heroin, ketamine, ecstasy, roofie, date or rape drug, methamphetamine, poppers, liquid gold, synthetic drugs, and many more. I don't want to go into detail, but parents, you must know how these drugs look and what are the symptoms when someone takes these drugs. Know your teens. In a study, it is found that kids who are unsupervised, they are more prone for taking risk-taking abilities and experiment on drugs. Stay involved. Take interest in the interest of your kids. Make a strong relationship with your child. Meet and get to know about the friends of your teen. Set the clear rules to your teen about the drugs. And next thing is that keep a tab on timetable of your child. There must be specific time that child should come back to your home, and when child is out from home, you must know with whom and where he or she is going. Encourage healthy eating and healthy physical activities in your child. I want to make all parents aware about some signs and symptoms of drug addiction in teens. Teens can show different signs and symptoms. Parents has to catch those clues. What are those clues are? There are many physical and behavioral signs that point to the drug use. Learn them and be aware if your teen acts or look different. The signs are slow or slurred speech, rapid explosive speech, bloodshot eyes, cough that does not go away, unusual order of breath, pupils that are extremely big, dilated, extremely small, pinpoint, rapid eye movement, loss of appetite or increased appetite, it happens in marijuana, unsteady gait. You may notice changes in teens' energy level also, sluggishness or constant sleeping, which happens in opioid drugs such as heroin and codeine. Hyperactivity is seen in cocaine and methamphetamine. You may also notice changes in your teen's behavior, like poor grades in school and missing more school days, not taking part in usual activities, change in group of friends, secretive activities, lying or stealing. These are the few preventive steps. But what if your teen starts taking drugs and you are not aware? That's one of the most dangerous part. If you come to know about that your teen is taking drugs, you can take many steps. Though drug addiction is like a disease which comes but difficult to go. But my dear parents, we have to take some steps. One of the most important steps is that know the reason why child is taking drugs. It can be because of family discord, divorce, tension, some problem at school, some problem with the kids and his company of friends. Get involved with your child, spend more time, understand them, communicate them, support them. That's the only way that someone can come out of drug addiction. And one of the most important thing is that love them if they are taking drugs also. In the end, I want to share that is not very good news, that with increase in urbanization, this problem of drug addiction is going to increase. The only solution is vigilant and involved parents. In a short time, my dear friends, whatever I want to discuss, I have discussed with you. Just love your child, spend more time with them. Parenting is fun, parenting is bliss. Please share our video with your near and dear ones and subscribe our channel. Thank you very much.